So I said today's webinar is all about the additional 102 million, which was announced earlier this year. So I'll hand over to Mark Browne from the Department of Health and Social Care to give an intro and kind of there. I suppose your what you'd like to see the money spent on, Mark.
Thanks very much, Paul, and good afternoon, everyone. So I'm Mark Browne from the Adult Social Care Group at the Department of Health and Social Care. I'm going to start by thanking everybody for giving up some of their time this afternoon. Thank you to Paul for bringing us together, and thank you in particular to our colleagues who will be presenting later. So yes, I'm just going to speak just very briefly for a few minutes, just to set a little bit of the policy context and why we've been working with Paul to put on a few webinars on this subject. So I'll take us back to our People at the Heart of Care white paper, which was published some time ago now, December 2021, and that sets out a 10-year vision for reforming the adult social care sector, and in particular making sure that people have the choice, the control, and the support to live independently. I like the expression living behind your own front door, and where that's what people want to do, that's what we want to support them to do, because as you know, many experts on the call will know, if you get that home environment right, if it's right for the person, if it's of good quality, if it's safe, if it's suitable for them, that just does an enormous amount to help them stay living independently at home. And I should say that we're talking as much about older people as we are about people of working age with physical disability, a learning disability, autism, and so on. The most important thing, of course, is that I think when we're all living where we want to live, with the people we want to live with, then it's all about the quality of life and the outcomes that we want for ourselves. And that, after all, is why we all get out of bed in the morning. And I don't need to tell you, of course, that adaptations, home adaptations, whether they are big adaptations like a walk-in shower, a stair lift, whether they're small adaptations like supports to use the bathroom, or supports tools in the kitchen and so on, can be hugely effective in enabling that independent living, along with some quite sort of practical steps like sort of minor repairs and so on. And in particular, something that I think is fair to say has risen up the agenda a little bit since the white paper was published, not just in a preventative context, but also where people do spend a spell in hospital, or they're leaving a residential care setting. It really helps people get back home where quite possibly they would rather be. So that's really the context. That's what we're all trying to achieve here. Now, I know that many local places have some really great services in place, often through home improvement agencies, that are really providing a range of responsive, agile support to do all that stuff for local residents. And we're going to hear a couple of great examples today. Essentially, what we want to do from the DHSC is just to support, to encourage more places to be following that lead. Part of that is showcasing some of those great examples. Part of it is the partnership work we do with Paul at Foundations to help people understand, the art of the possible, to help them with guidance, with tools, with case studies, and so on. And it's all about sharing that and spreading that good practice. Paul mentioned that there is some new funding announced in Next Steps to Put People at the Heart of Care, which is a sort of a follow-up document to our white paper that came out in, I'm going to say, March this year. I think that's right. And that new funding is £50 million for this year, £52 million for next year. And that can help to support some of those local places to go further. So that's an important piece of context. I'm going to just say a few things about that new funding. Many of you on the call already will be very familiar with this, of course, but there are those flexibilities available to local places through regulatory reform order to offer a wider range of services to local residents. Okay, and the new funding is basically governed by the same arrangements, the same grant conditions as the core DFG. Now, the reason we did that is it seemed to us just really sensible to use the same vehicle to get that money out to local places, because it's a a familiar grant, familiar set of conditions, and importantly puts it right into the place in the local system where those home improvement policies are being developed. That does mean there's some limitations, so we do still have to navigate around those definitions of capital expenditure, and those are some, I'm going to say, fairly sort of complex and detailed sort of parameters, but the guidance that is published by our friends at DLUC, the Levelling Up Department, is online and explains that in a lot of detail, lots of examples, and essentially that is the touchstone for you, I would say, along with all the support and expertise that Paul and colleagues at Foundations can offer. Really important point, I think, to raise is that the additional money, and I'm sure we'll hear a bit about this in the examples later, can really help maximise the impact of other funding streams coming out of the sort of the general adult social care budget, and that can include, preventative services, some of those listed on the slide there, but particularly, I think, because it sort of holds those conversations in the same local partnerships and the joint working that local places will have in place to a large degree already in terms of how they deliver the DFG. And of course, that sits in turn within the context of conversations in the local BCF between the local government and the local NHS partners, for the sort of overall health and care strategy for the local area, for the local community. So that's a little bit of context. And just finally on the timing, in the summer, that's now, we're starting a bit of dialogue with local places through these sessions, really to, exactly as I said, raise awareness of some of the great examples that are out there, raise awareness that there is this new funding coming on down the track and how that might be able to help. We want to get the money out the door and into local authorities' bank accounts early autumn. Be further opportunities to explore what we can do with this in some of those roadshows that Paul was advertising a few minutes ago. And then as we move into the next financial year, we intend to roll the money into the sort of the one allocation, the main business as usual allocation of DFG, which would get out to local places. May is what we've managed to do over the last 3 years at least. And we'll be starting to see, I think, then some of the reporting coming back from local places through your Delta returns and through the BCF reporting as well. And we can understand a little bit more about the impact that money is having. So that is all I will say for now. I just have to work out how to stop sharing my screen. There you go, maybe that worked. And I shall hand back to Paul, and just looking forward to hearing the speakers from Oxfordshire and from Heart of the Midlands later, and answering any questions that we can help you with. Thank you very much, Paul.